Hello guys, welcome back to pharmD Explains. In today's video, we're gonna talk about peptic ulcer. So what is peptic ulcer and how it is caused, what are the types, pathophysiology, clinical presentation, diagnosis as well as its management. So what is peptic ulcer? Peptic ulcer is a localized break or a sore in where it will be caused in the mucosal lining of the stomach or the first part of the intestine. It is divided into two types, gastric ulcer and duodenal ulcer. So what is gastric ulcer and duodenal ulcer? If the ulcer is formed in stomach, then it is called as, if the ulcer is formed in stomach, it is called as gastric ulcer. And if it is formed in duodenum, which is the first part of the small intestine, then it will be called as duodenal ulcer. And how do we differentiate between gastric ulcer and duodenal ulcer in the clinical presentation? When the onset of pain, abdominal pain is before taking the food, then it will be gastric ulcer. If it is after 2 or 3 hours of taking the food, then it will be duodenal ulcer. Then what are the causes of peptic ulcer? First is H. pylori induced ulcer, which is a gram-negative bacteria, and second one is use of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs such as ibuprofen, aceclofenac, diclofenac, aspirin, and etc. Now we will discuss the pathophysiology of H. pylori induced ulcer. The H. pylori bacteria resides between the mucous layer and surface of the stomach after it goes into the body. Then it produces direct mucosal damage by hypersecretion of gastrin, which leads to hypersecretion of gastric acid and also alterations in the inflammatory response of the body. Then we will move to the NSAID induced ulcer, NSAID induced ulcer. The NSAID is non-steroidal anti-inflammatory drug induced ulcer is caused by mucosal damage by inhibition of prostaglandin synthesis by inhibiting COX-1 enzyme. So the NSAID inhibits the prostaglandins, which is responsible to inhibit the gastric acid secretion as well as increase the bicarbonate and the protective mucus layer of the stomach. If this is inhibited by NSAIDs, then there will be increased HCl production, which can cause sore or ulcers in the stomach. Clinical presentation of peptic ulcer involve mild epigastric pain, burning sensation, cramping, abdominal fullness. Pain is also associated with nausea, vomiting as well as anorexia. Anorexia means feeling fullness and not able to eat. And then also the untreated peptic ulcer patients presents with life-threatening conditions such as bleeding, perforation, penetration, obstruction in the GIT, and it is a very severe form of GIT, peptic ulcer disease, and it should be treated promptly, otherwise it will lead to death. Diagnosis of peptic ulcer disease is mainly by clinical presentation, and it can also be confirmed by test for H. pylori as well as performing endoscopy of the upper GIT. Treatment of peptic ulcer involves non-pharmacological therapy, which is to avoid or reduce the psychological stress, avoid smoking as well as to avoid beverages, spicy food, caffeine. It worsens the peptic ulcer disease, so it should be avoided. And then we will come to the pharmacological therapy, which is most important part in this video. Then for H. pylori induced ulcers, the recommended guideline is to treat the patient, to give the patient antibiotics and the treatment for minimum 7 days and preferably up to 14 days. So what we're gonna do with H. pylori induced ulcer? As we all know, this is a gram-negative bacteria. So we will go with the triple drug therapy, which includes clarithromycin 500 mg 2 times a day and amoxicillin 1000 mg 2 times a day, or metronidazole, or we can give metronidazole 500 mg 2 times a day. And we will include a proton pump inhibitor drugs, which is pantoprazole 40 mg 2 times a day, omeprazole 20 mg 2 times a day, rabeprazole 20 mg 1 times a day, as well as esomeprazole 40 mg one time a day. It should be these all PPI should be given, either one of it should be given. And for NSAID induced ulcer, we have to stop that drug. If drug can't be stopped, then we have to start with the PPI, proton pump inhibitor, and change the NSAID, which is non-selective drug, to a selective COX-2 inhibitor such as celecoxib. And we have to give either PPI, proton pump inhibitor, H2 receptor antagonist, it is like ranitidine, loratadine, and or we can give sucralfate, which will give a protective coating to the stomach, and it will heal the ulcer very fast.
Thanks for watching pharmD Explains. Don't forget to like this video and subscribe for more pharmacy